In this video, we are going to talk about how to detect, prevent, and control high blood pressure. This video is based on 2025 guidelines by American Heart Association and American College of Cardiology. First, what is blood pressure? When your heart pumps throughout your body, it creates a pressure on the walls of your blood vessels. This is called blood pressure. It is a key indicator of your health. Why should you monitor your blood pressure? High blood pressure, otherwise called hypertension, is a silent killer. It often shows no symptoms, but if left uncontrolled over the long term, it can lead to serious problems like heart attacks, strokes, and kidney failure. How is blood pressure measured? Blood pressure is stated with two numbers. For example, 120 over 80. Top number is called systolic, the pressure when your heart contracts and pushes blood out. The bottom number is called diastolic, the pressure when your heart rests between two beats. The blood pressure is measured by millimeter of mercury. Blood pressure categories. There are four categories in the blood pressure. Either it could be normal, elevated, or stage 1 high blood pressure or stage 2 high blood pressure. What is normal blood pressure? When the systolic blood pressure is less than 120 and diastolic blood pressure is less than 80 is called normal blood pressure. When the systolic blood pressure between 120 to 129, but the diastolic blood pressure is less than 80, that is called elevated blood pressure. This is a warning. You are at risk of developing high blood pressure, so lifestyle changes are needed at this point. Third is stage 1 high blood pressure, wherein the systolic blood pressure ranges between 130 to 139. Diastolic blood pressure ranges between 80 to 89. This is early stage of high blood pressure. Lifestyle changes and sometimes medication may be needed. Finally, stage 2 high blood pressure, where the systolic blood pressure is 140 or higher, diastolic blood pressure is 90 or higher. This is called severe high blood pressure. It requires immediate medical attention and medications. This classification is based on blood pressure reading taken correctly in a doctor's office. These ranges were created based on a research that proved these numbers are achievable targets. How common is high blood pressure and who is at risk? High blood pressure is a very common problem. In the United States, 46.7% of the people aged 18 to 80, almost half the population have high blood pressure. The risk increases with age. For example, if your age is between 20 to 44, the chances of having blood pressure is 20 to 40%. That increases when your age is 45 to 59. The risk is 50 to 57%. When the age is 60 and above, your chances of having blood pressure is 70 to 85%. Risk is higher in some racial groups. Risk is highest among black individuals. The next highest among Hispanic and white individuals. There are other risk factors too. Obesity, excess weight puts more strain on the heart. And family history. Risk is higher if a family member has it. Unhealthy diet, like eating food high in salt and fat, lack of physical activity, smoking and excessive alcohol use, all these can increases your chances of having high blood pressure. What are the dangers of high blood pressure? Long-term uncontrolled high blood pressure puts strain on your blood vessels and internal organs and damaging them. In the heart, it can cause heart attack, heart failure, and thickening of heart muscle. In brain and nerves, it can cause stroke, memory loss, and dementia. In kidneys, it can cause kidney failure, may require dialysis. In the eyes, it can cause vision impairment and blindness. In blood vessels, the complications can occur during pregnancy. It can cause aneurysm. Controlling high blood pressure can significantly reduce all these risks. How to measure blood pressure correctly? Tips for an accurate reading. An incorrect measurement can lead to a wrong diagnosis. So follow these simple steps to avoid incorrect measurement. Before measurement, sit quietly and rest for at least 5 minutes before measuring. Avoid smoking or drinking caffeinated beverages 30 minutes before measurement. It's good to have an empty bladder before measurement. Do not talk during the measurement. During measurement, sit up straight with your feet flat on the floor without bending your knees. Your back should be supported by the chair and your arms should be resting on a table at heart level. The cuff should fit properly on your arm. This is very important. One measurement is not enough. Measure at least 2 times and take the average of the two. Measure on both arms and consider the higher number. Other important aspect is home blood pressure monitoring. Measuring your blood pressure yourself at home is very useful. Why measure at home? It helps avoid white coat effect. What does that mean? When BP rising automatically when seeing a doctor, that is called white coat effect. Measuring daily gives good understanding of how well medications are working. So, home measurement is very important. It also helps a doctor adjust the treatment plan. Instruction for measuring at home. Number one, choose the right machine. Choose an upper arm machine. Wrist machines can be inaccurate. Ensure the machine is validated. Second, measure at the same time each day, usually in the morning before taking medication and in the evening. Third, each time measure 2 to 3 times with that 1 to 2 minute gap and take the average. Record daily recordings in a notebook or phone app and show it to your doctor. The home measurement should generally be below 130 over 80 millimeter of mercury. What are the key causes of high blood pressure? The high blood pressure is the result of combination of many factors. Number one being lifestyle factors. And otherwise, it is modifiable factors. Eating too much salt, the most important factor. Second, obesity or overweight. Third, lack of physical activity. Fourth, unhealthy diet like eating less fruits, less vegetables, and less whole grains. Excessive alcohol use. And finally, stress. These are all modifiable factors causing high blood pressure. The next category is non modifiable or non controllable. One, age. The risk of high blood pressure increases with the age. Second, family history. Third, chronic diseases such as diabetes, high cholesterol, and chronic kidney disease. And taking some medications such as pain relievers, glucocorticoids. By changing your lifestyle, you can prevent or delay high blood pressure even if you have genetic risk. So, how to treat? Number one, lifestyle changes. This is called lowering pressure without medication. Lifestyle changes are the first and most important step in the treatment. They can reduce or even prevent the need for medication. Number one, weight loss. Keep the BMI, body mass index, less than 25. That itself reduces the blood pressure 5 to 10 millimeter of mercury. Make small and sustainable changes. Very important point. Sustainable changes. Second, reduce salt or sodium intake. What does that mean? Less than 2300 milligram per day. Ideally, like to have less than 1500 milligram of salt per day. That itself reduces the blood pressure by 5 to 8 millimeter of mercury. Avoid packaged foods, processed foods, and eating out. Usually, the restaurant foods are high in salt and high in fat. Next is DASH diet. That diet includes fruits, vegetables, and whole grains. The DASH diet bring down the blood pressure for 5 to 8 millimeter of mercury. Add one fruit or vegetable to every meal. We have done a separate video on DASH diet. It is in our channel, Medicine Made Simple. Please listen to that one. DASH diet was designed or created by National Institutes of Health. Next step is exercise. Do 150 minutes per week. It reduces the blood pressure by 4 to 8 millimeter of mercury. Walking, swimming, and cycling will help to achieve that. Reduce alcohol. If you're a man, less than 2 drinks per day. Women, less than 1 drink per day. It reduces the blood pressure by 4 to 6 millimeter of mercury. One drink means one beer or one glass of wine or one shot of liquor. Increase potassium. 3500 to 5000 milligram per day. It reduces blood pressure by 4 to 6 millimeter of mercury. Eat bananas, oranges, potatoes, leafy greens. And others, stress management like meditation, deep breathing, yoga can help reduce BP by up to 5 millimeter of mercury. Finally, medications and medical treatment. If lifestyle changes alone are not enough, your doctor will recommend medications. Medications help relax blood vessels, reduce the workload on your heart, and reduce the amount of salt and fluid in your body. The common types of medications are number one, diuretics, often called water pills. They remove excess salt and water from the body. Second group is called ACE inhibitors, angiotensin converting enzyme inhibitors, or ARBs, angiotensin receptor blockers, the medication that relax and widen blood vessels. Third group, calcium channel blockers. It relax blood vessels and make the hearts work easier. Finally, beta blockers slow the heart rate and reduce blood pressure. Always take your medications exactly as prescribed by your doctor. If you experience side effects from the medication, tell your doctor immediately without stopping the medication. They can switch you to a different one. Do not stop medication just because your blood pressure is under control. The key messages from this video are as follows. Know your numbers. Be aware of your blood pressure numbers. Get checked regularly. Second, change your lifestyle. This is the first and best medicine. Focus on diet, exercise, and weight control. Third, follow your doctor's advice. If you are on medication, strictly follow your doctor's instructions and monitor at home. If possible, buy a BP monitor and measure at home. It leads to a better control. Finally, do not lose hope. High blood pressure is a lifelong condition that can be managed. With proper management, you can live a long and healthy life. If you're concerned about your blood pressure, consult your family doctor. A simple test can save your life. Please share this information with your friends and family. As we mentioned earlier, this is 2025 guidelines by American Heart Association. Thanks for watching.